Hello, I'm urologist Omer Erdamakaya. Today I'll give you a short video presentation on L-arginine and L-citrulline. L-arginine and L-citrulline are the main sources of nitric oxide in the body. The body can produce both itself and can be taken from the outside. When we use Viagra or Cialis for erection, it is nitric oxide that increases in the penis. In other words, since the nitric oxide increases, the penis fills with more blood and the blood vessels remain wide for a longer time and an erection occurs in the penis. This is how the main mechanism works. When we take arginine or take L-citrulline, the amount of nitric oxide in our body increases. Does this contribute to erection? Yes, studies have shown an increase in erection quality when arginine or L-citrulline is taken from the outside. But how much do you need to take? When you look at it, it is possible to see arginine in many supplements. But how much is the amount? 100 milligrams to 200 milligrams or something. These doses remain very low in the use of arginine. When arginine is to be used, it is necessary to use 4 to 5 grams of arginine so that arginine can reach the target cell. Because when arginine is taken orally, it is eliminated from the intestines and liver, it's not that beneficial. L-citrulline is more advantageous in this regard. Again, it reaches the target cell better when 8 to 10 grams is taken. So, there is no reason to use low doses of arginine. Apart from that, we said that arginine increases the quality of erection, and it increases growth hormone. It increases IGF-1. So, what are the side effects? It can cause problems with the stomach and intestines, and increase the severity of herpes simplex or genital herpes. It may cause reoccurrence in patients who have had it before. This product should not be used without consulting a doctor because it can lower blood pressure when used with Viagra or high blood pressure medications. Apart from that, in the videos I watched about arginine on YouTube, many people said that arginine is not very meaningful in muscle development. This makes sense because if you are taking testosterone from the outside, there is not much point in using arginine, because testosterone greatly increases the amount of nitric oxide in the blood. It even converts arginine in the blood to nitric oxide and the amount of arginine decreases. And since it increases fat burning, widening blood vessels, and blood supply to the tissue, it already does arginine's all duties. That's why I think that someone who takes testosterone from the outside can easily close it by eating arginine. When it should be used for erectile dysfunction, I think it is a substance that should not be used without asking the doctor. This is all about arginine. Thanks for listening, best regards.